Hello, everyone. Here again to talk to you about leading through the white water of change. I think that's I like that title very much. As you can see, I put pictures of here of going through whitewater. I don't know whether any of you have done it. I have, and it's quite thrilling, but at the top here with the first picture is that you kind of go into this white water. It's a little slow, kind of steady. And then the more you go into it, all of a sudden you're in this great big soupy mess of water. So one way to show the whitewater of change is what William James said: the great use of life is to spend it on something that will outlast it. And change is something that we hope will outlast what we need. So let's take a look at this, because we're going to go through the rapids. So we've all been involved with technology and how sometimes it can be disruptive because there's new innovations all the time in technology. Sometimes we learn one and then another one just comes along. So it can be disruptive because it's constantly changing. Sometimes we have it's unanticipated. All of a sudden there was a technology that was developed and we weren't expecting it. And so we have to learn it quickly. Sometimes the technology is a threat to existing products. We have been using a certain product for a long time, and now there's a switch because of new technology. Sometimes it's an unexpected competition between technologies. And sometimes it's revolutionary and can be destructive. Maybe the technology is not working with our current technology that we have. That could be disruptive for a lot of reasons. Destructive, I mean. So remember what we discussed about it in the first week is the historic form of work. And it has, through history, been an emphasis on function, following policy and procedure, making sure that all of the policies and procedures are in place. It's characterized by control, almost autocratic most times. It's employee oriented, but yet it's strictly managed. And then it's been active, but nobody would take the time to reflect on how the work was being done. Was it being done in a good manner, in a proper manner, so on. There's also been oppressed groups throughout history, and some of us will say that some of these still occur, like gender inequity. We know that we still have men being paid more than women. Unfortunately, everyone's striving to make that change, but I think it's going to take a while. Nurses have always been seen as a subsidiary role, meaning that they're not quite equal to everybody else. There's still tends to be the medical hierarchy where the physician is viewed as the leader of the healthcare, and nurses are viewed as having a narrow scope of competence. They're still at times looked as handmaidens of the physician. And there's more legislative protection of the medical role than there is of the nursing role. I think that's changing quicker than what maybe some of us anticipated, but it's still there, especially in the area of the medical role versus the advanced practice role. There's still struggles throughout the nation, some areas more than others, about protecting the medical role versus allowing advanced nurse practitioners to practice independently. We all strive for equity. We want things that are value-based, that it shows accountability. It's characterized by equality. There's horizontal relationships among team members instead of the hierarchy relationships. And it's inclusive. What it means is that members of the team and the people involved are taking ownership of the product, the quality, the change, anything that is occurring at the time. The professional mandate is basically summarized in just a couple sentences, although there's quite a bit on the screen. The profession is not obligated to the members, but the members owe an obligation to the profession. In other words, sustaining its value and work, meaning the profession. The profession is defined by the collective action of the members and not the individual action. So a profession can only grow and change by the collective body instead of individuals. From position to decision. This involves everyone is positioned, and most of the time it's at the point of care where we need to make the decisions related to change. So that is where we should always start, is at the point of service, point of care. From position to decision, it's always been positional control, which is hierarchy. I think I've talked about this a lot. Whereas we want to move to decisional control, which is relational, multilateral, user-driven. It's no longer we have control of the situation, but the user is going to take more ownership. It's value-oriented, and we should see a direct impact on the services or the change that we're providing. Locus of control. When we think of locus of control, we mean organizing in a way that supports persons legitimately planning and affirming the appropriate place where the decision could be effectively located in the system. In other words, we need to ensure that people at the point of service have the ability to make decisions. That's what it boils down to. The trajectory of diminishing successive initiative changes. When we're starting to make changes, it's most productive in the beginning because a lot of time you can develop a lot of excitement about it. And then, so people are willing to invest more time and effort. But there becomes a point when there's diminishing returns. And this happens whenever there's change upon change upon change that is occurring. And people get overwhelmed, and you stop movement in that process of change. And so the output for change starts to diminish. And then there becomes a time where the people that are doing the change and receiving the change or working with the change hit a point of maximum yield. And it just starts to decrease the overall output because people are basically burned out at that time. So you want to keep an eye on how change is going. Remember to reflect on it, to evaluate it so that you can keep it in a productive mode. Again, we have to remember that point of service. That's what the system should be built around, is that point of care, and that's the whole purpose of the system. So what are the elements of motivation? It has to be internally driven. People they have to know what motivates them. And whenever we're promoting a change, the change has to be consistent with personal values. If people do not see the value of the change, or if it conflicts with their personal values, you're not going to see the change happen. People should want to be engaged in change. If they're not engaged in the change, then again, change is not going to occur. People have to own what's going to be changed, and how they see the change is that it's going to be advantageous for them. It's going to help them with their workload. It's going to help them to take better care of their patients. It's going to smooth out a process so they're not needing to chart in 3 different places, as an example, to document one thing related to a patient care. So it needs to be advantageous. So creating a context for innovation. Again, the old models are out. We're wanting to see the new models, taking ownership, having people participate in the change, feel a challenge for the change, be engaged, all of these things that we've talked about so far. So we've reached calm waters again. We went through the white water of change. And once your team has done that, then everyone's excited and ready to go on to the next white water of change. So I hope you've learned something today. I've enjoyed talking to you, and I'll see you soon. Have a good day.